We are talking about an eating disorder, which is characterized by purging and the binging phenomena. Now, there is a psychopathology that is underlying these kind of an eating disorders. The person basically suffers from extreme fear of gaining weight, and then he has these delusions that he is already overweight. Then he has this strong desire to lose a lot of weight and get into shape. And why is he basically striving towards all of these goals? What is the thought form that is behind all of these goals that he has in his mind? Basically, he sees the self-esteem, he sees the self-worth equalizing with losing weight. So this is the thought form behind the psychopathology or behind all of the eating disorders usually. Especially, we have already discussed the anorexia nervosa. That was a very common disorder seen. Then we have this another common disorder which is known as bulimia nervosa. So the thought form is the same for both of these eating disorders. Basically, the person equalizes self-worth or self-esteem with losing weight. So these are the thoughts that are behind it. Then there are a lot of pessimistic thoughts of the self-analysis. Basically, the person self-analyzes him as a food lover. So again, all of these features are going to be there. The pessimistic thoughts are going to be there. A complete history taking has to be done in a very systematic manner just to get to the diagnosis of this particular condition, which is known as bulimia nervosa. The eating disorders are quite underrated because the people usually think eating disorders won't lead into any mortality, but that is not usually the case. The people can usually be self-harming themselves, and they can be characterized as the deliberate self-harm people, the DSM people. So even people with the eating disorders can be categorized into a category which is known as the DSM, the deliberate self-harming people. So the psychopathology will be discussed over here in this section. The two episodes that I've already mentioned, that is, the person will have a binging episode that is characterized by consuming the large amounts of food in a very short period of time. And after that, the person will have the purging episode. The person will try to get rid of those large amounts of food by placing enemas, by getting the drugs which can induce vomiting, and so that is how he's going to get rid of the large amounts or the consumed food that he has already taken. So these are all the fears, these are all the thought forms that he has in his mind. Over here we'll be discussing the history of this condition. So how was it discovered, who discovered it, and what were the features that led to the discovery of this eating disorder, this interesting disorder which is known as the bulimia nervosa. The risk factors will be discussed over here. As any psychiatric condition, as any psychiatric modality that we usually deal in. Over here even the basically risk factors revolve around the person himself, and then there are a lot of environmental factors as well. So we'll be discussing them even over here in this section. The risk factors can be from the environment, they can be physical, they can be psychological, they can be socio-economic, and they can be of the cultural sort. So we'll be discussing them over here. What factors can lead to the development of this condition which is known as bulimia nervosa. So talking about bulimia nervosa, how do you first of all go about the definition of this condition? It is basically an eating disorder which is characterized by binge eating followed by purging. We've already mentioned binging is an episode of consuming large amounts of food in a very short period of time. Even people not suffering from bulimia nervosa would go into these binging episodes. But if the binging episodes are not hindering with the normal activities of life, then the person is not basically suffering from any psychiatric condition. It can be even a normal binging episode even in a normal person. But if these are the two characteristics, the binging and which is followed by purging. Purging is the getting rid of that consumed food by vomiting or by placing enemas or by getting the laxatives, by getting the diuretics. All of these drugs are usually self-administered administered by the person who is suffering from bulimia nervosa. So these will be the characteristics. This is how you will go about defining this condition, which is known as bulimia nervosa. The history and prevalence is again very important over here. When we go about the history of this condition, which is known as bulimia nervosa, it's basically a Greek word which means hunger of an ox. So it's again very important. You basically go about this definition, you basically go about this history taking in a very interesting manner. The meaning again is of the hunger of an ox, which is basically highlighting the binging episode. As a person eats large amounts, so basically he has a large appetite, and that is why the binging episode is simulated with the hunger of an ox, which is basically showing the appetite of the person suffering from this condition. Then dating back for thousands of years. So the history started back thousands of years, and people have been investigating this kind of conditions even in the past. It was first described by Gerald Russell in 1979, and in 1980 to 1990 there was an increase in the Western societies. So the comorbidities obviously existed in the Western societies, or the awareness was spread in the Western societies, in the developed countries regarding this kind of a condition. And so even the incidence increased in between 1980 to 1990. In the last 20 years, the average onset has decreased due to the awareness and due to the treatment modalities that coexist with these kind of conditions. The estimated prevalence is almost 1% in the young females. So again, the prevalence is more in the females, and then we have the incidence in the males as well. And there has been a recorded incidence even in the adolescent age group or even in the child age group. So depending upon these comorbidities that coexist in these individuals, in these characteristic populations, this condition also coexists with these comorbidities. Now, moving on to the risk factors that involve, while we are talking about this condition, which is known as bulimia nervosa. Now, as any psychiatric modality that we usually deal in, the risk factors usually start on with the environment of that person, the socio-economic status, the cultural background of that person, the cultural ethnicity of that person, and then we move on to the person himself. Even the health and illness can contribute towards the psychiatric condition of that particular person. And then the other psychiatric comorbidities, if they exist in that particular person, for example, schizophrenia, schizoaffective disorder, there can be the mood disorders, there can be the anxiety disorders or the panic disorders, including even the phobias, if they coexist in that particular person. They are similar to anorexia. So we have to characterize by basically bulimia nervosa and anorexia nervosa belong to the same group known as the eating disorders, and so they're quite similar to anorexia nervosa. The previous episode of anorexia nervosa is usually highlighted if the history is taken in detail. So usually the patient will give you the history that he has stopped eating. The fears, the thought forms are again the same, or they're of the same content. The thought content is even the same. He has the fears of gaining weight. He has the delusions that he's already gained weight. So all of these fears, all of these thought forms are going to be there in that particular person that we talk about. The history of weight loss is there in this particular person, and then the person is already on quite a strict diet. He has restricted his diet, and this diet restriction is basically to the level that it is affecting his or her normal daily life routines. It is basically hindering in his life activities. So even we have to focus on these factors as well. The cultural pressures are again seen in these people. Usually, the environment would usually lead you to this severe kind of food restriction. So these cultural pressures are seen in these people, the traumatic events and abuse. So taking the child history is again very important. Was the person basically intolerant to some particular food in the childhood? So basically, even if he had a child, history of abuse or even trauma, that would lead to a psychiatric condition, this kind of an eating disorders, even the anorexia nervosa, or even they can lead into bulimia nervosa. So the parental obesity, one can have the fear that he may lead to the same level of the parental obesity as his or her parents have been suffering with. The serotonin dysregulation is usually seen in these individuals as well. So some kind of a biochemical change is brought about in the brains of these individuals as well. That can basically lay the foundation to these kind of the thought form or the thought contents. Now, how bulimia affects your body is again very important. The brain, how does it go about it? There are the depressive thoughts in the brain of the person. The fear of gaining weight is there. Then there is anxiety, there is dizziness, there is shame or a low self-esteem. This shame or this body shaming is basically due to the low self-esteem that the person has. The cheeks are going to be showing the swelling and the soreness as well. The mouth cavity, when we look at it, the tooth enamel erosion is seen in these individuals, and then the gum disease, the teeth are sensitive to hot and cold foods. So these are the sensitivities that are usually observed in these individuals. Then when we'll be examining the throat and the esophagus of these individuals, it is usually sore, it is irritated and can tear and rupture, or the blood is also seen in the vomitus of these people because of those purging episodes that they usually go through. Then the muscles will be fatigued because the muscles will not be getting the balanced diet, that is the proteins, carbohydrates, and the fats in the right amounts. So the stomach will also suffer from ulcers, pain, and can rupture due to the delayed emptying phenomena. Because there will be these episodes of not eating at all and the restricted diet phenomena, and then he'll be eating large amounts of food in very short periods of time. So that all of these phenomena are going to lead to the ulceration of the stomach lining. And then when we'll be observing the skin of these people, there will be aberrations on the knuckles, and there will be the dry skin or the acanthosis, which is seen in such individuals. Then dark lines, they basically indicate the organ is behind often the main organs. The blood will usually reveal the anemia in such individuals. After the examination of the heart, there will be an irregular heartbeat in such individuals. The heart muscle is usually weakened in these individuals. There will be heart failure, or they are at a risk of heart failure. There will be a low pulse, and then the blood pressure will be in there will be a low blood pressure. So that is going to be observed in such individuals. The body fluids, basically the person will be dehydrated. There will be a low potassium, magnesium, and sodium concentrations. Moving on to the kidneys, there will be problems from diuretic abuse. So there will be a self-administration, as we've already emphasized on the fact that the person will be self-administering diuretics, he'll be administering enemas. So all of this is going to affect his body as well. The intestines, usually the person is suffering from constipations or irregular bowel movements. There'll be bloatment, diarrhea, abdominal cramping is also observed in such individuals. The hormones are usually irregular, or the female is going to give you a history of absent periods or amenstrual periods or amenorrhea or dysmenorrhea as well. So all of these signs can be observed in people suffering from bulimia nervosa, and usually upon taking a complete detailed history, all of these signs can be worked out when you're taking the complete detailed history in that particular individual that we're talking about. The psychopathology that usually involves in this particular kind of the psychiatric condition, there is going to be a hunger and urge to binge. Binge has already been characterized by consuming large amounts of food. Now, this dysregulated frontostriatal circuitus is again very important over here, which is acting upon that binging episode. There is an impaired self-regulatory control. The person cannot usually stop himself while he's eating, and he keeps on eating. That is basically going to give you an idea why the person has that strong urge to eat those large amounts of food in a very short period of time. Then this binge eating is usually done after this urge and after this impaired self-regulatory control. The person usually goes into this binge eating episode. And after that, there is a compensatory behavior for that binge eating. The over-reliance on the SR, that is the reward-based learning, the hippocampus and the amygdala. So these two parts of the brain are involved in that purging episode. The hippocampus is going to be activated, the amygdala is going to be activated, and that is going to cause that purging episode after that binging phenomena. So this is the psychopathology that involves or that revolves around this particular kind of a condition, which is known as bulimia nervosa. So in this section, basically, we gave you a baseline about this particular eating disorder known as bulimia nervosa. What is the psychopathology behind and what are the risk factors that revolve around this kind of a condition? So that is the end of this section. Thank you for watching sqadia.com.